Hello. Hello, friends. How are you doing? Welcome to this recall session of INI-CET of anesthesia. Right. So, okay. Right. So, guys, starting with this first question, which came, the first question was, which of the following is a second generation LMA? So, guys, again, if we go back to the LRR of anesthesia of INI-CET, in that I have mentioned LMA, there are two types. Laryngeal mask airway, there are two types. One is the first generation, other is the second generation laryngeal mask airway. Okay. Second generation laryngeal mask airway are the airway devices which are having two ports. One is the tracheal port, other is the esophageal port. Okay. So first generation, we are having only one LMA, that is the classical LMA. So the question over here is, which of the following is a second generation LMA, right? An ambio LMA, intubating LMA, classical LMA, these are all having only one ports. These are having one port. The only LMA that has two ports, one is the tracheal port, other is the esophageal port, is what, guys? LMA ProSeal. LMA ProSeal. Now, guys, remember, if we are discussing about the second generation LMA, in second generation LMA, we are having LMA ProSeal. Apart from LMA ProSeal, we are having Supreme LMA, Supreme LMA, and apart from Supreme LMA, we are having iGel. iGel is an LMA which is without any cuff. That is an iGel. So in second generation, you're having ProSeal, Supreme, and iGel. As you can see in these pictures, you're having ProSeal, you're having the LMA Supreme, and this is the iGel. So in second generation, you're having this LMAs. Coming to the next question, guys. Which of the following is the induction anesthesia of choice in pediatric age group? First of all, guys, you need to understand this. Induction anesthesia of choice in children or pediatric age group. Induction basically is done by IV induction agents. Induction means you need to make the patient unconscious by IV induction agent. But as children do not allow you to put an IV cannula in children, we can go for inhalational induction. And again in the LRR session, while we were discussing the inhalational agents, I had mentioned you over there. Okay? This is the slide that I had. These are the slides which I have picked up from the LRR session, guys. Okay. So while discussing sevoflurane, I told you sevoflurane is the inhalational agent that can be used for induction maintenance as well as endotracheal intubation. Okay. Sivo, I told you, Sivo is sweet. Sweet is used in children. So inhalational induction agent that could be used in children, it is always sevoflurane. Desflurane we won't use. Why? Because desflurane se hoga kya? Desflurane will cause airway irritation. So we won't be using desflurane. We will be using sevoflurane for induction in pediatric age group. Okay. Next question, guys. Which one of the following is the incorrect step in the ideal sequence of effective CPR? For this answer, again, I'll go back to the LRR session of INI-CET that we have done. Okay. In that, I told you guys, for an effective CPR and all, these things should be there. I told you about chest compressions. How many chest compressions should be there in a minute? 100 to 120. It is just the cut. I have just copy pasted the slide, guys, from that session. Okay. So number of compression should be 100 to 120. The depth of compression should be 5 to 6 centimeters or 2 to 2.4 inches. The ratio, compression is to ventilation ratio, should be how much, guys? It should be 30:2. Okay? And then you have to allow the complete chest recoil, right? So these are these are the steps of effective way of delivering the CPCR. Now, what is not given over here, guys? Which one is incorrect? Right? 100 to 120, that is that's the basically the compression rate in a minute. That's completely right. Next, compression to ventilation ratio 30:2. That is also absolutely right. Allowed some complete recoil in between the compressions and all. That's again right thing. The wrong thing over here is the depth of chest compression is 2 to 3 centimeters. It's wrong. It is basically 5 to 6 centimeters or 2 to 2.4 inches. 2 to 2.4 inches. Okay. So that was the question regarding the, sir, it was depth of, it was 3 to 5. Again, 3 to 5 is also not the right thing, guys. 5 to 6 centimeters is the right depth of compression. Okay. 3 to 5, it can be done for the pediatric cases or basically in one hand chest compression for pediatric age group. But other options were the same. Right. Okay, guys. Right. Coming to the next question. I think this question was like this, or don't know, but more or less it was a similar question. Patient was planned for surgery under general anesthesia. In the induction phase, rocuronium was given. Okay? But the anesthetist did not succeed in intubating. Hence, which could be the best reversal agent used? Basically, a patient was planned for some surgery and you gave rocuronium as a muscle relaxant for intubation, but you did not succeed in intubation. Okay? Now, which could be the next reversal agent? Ideally, for intubation, we use choline. And if at all, after using choline, if you fail in intubating, then you don't give any reversal. You just wait for 3 to 8 minutes. Till that time, you just go for bag mask ventilation. But here in this case, rocuronium was given. So what is the reversal agent against rocuronium? Again, I'll go back to the slide of the LRR where we have discussed about the reversal agents. The reversal agent which is most commonly used is neostigmine, neostigmine is most commonly used. Apart from, dose of rocuronium was not given. Okay, dose was not given. Again, it doesn't matter also, guys. Dose doesn't matter also, but rocuronium was given. What is the reversal agent against the rocuronium? Okay. So remember, guys, neostigmine is commonly used for almost all type of muscle relaxants, but rocuronium requires a specific reversal agent, which is called as sugamadex. Sugamadex is a reversal agent which is commonly used for rocuronium and vecuronium. Rocuronium and vecuronium. Okay. Right. Right. Next, this was from the pediatric, guys, but still IV fluid of choice for pediatric patient. In pediatric patient, what is the IV fluid of choice? Come on, guys. This might have been discussed by the pediatrician also, right? What's the answer for it? The IV fluid of choice in pediatric cases is what? Normal saline with dextrose. Normal saline with dextrose. Okay. So, guys, these were the questions in anesthesia, right? How was this? How was your exam, guys? How was your exam? Was it good? Was it average? Average. Was the LRR session of anesthesia useful for you guys? Did you find the LRR session of anesthesia useful? Very useful. Okay, guys. If at all the some of you who were feeling that question, the exam was tough and all, don't get disheartened. Okay. Okay, guys. So these were the questions of anesthesia. I think. Yes, yes. Okay. So all the best, guys. All the best. You have given your best. You have given the exam also. Now just wait for the results and all. Okay. Don't think too much. All the very best, guys. Thank you. Thank you for the session.